today?
I'm doing good here.
Good. My name is Sydney, and I'm going to be your student nurse today.
Okay.
I'm a student here at Good Samaritan College. Can you go ahead and tell me your first and last name and your date of birth?
Caleb Clough, 12/15/1998.
Okay, thank you. And before I continue, I just want to show that I have my stethoscope, my watch with the second hand, and my pen light ready. Okay, I'm first going to ask you just a couple questions. Are you in any kind of pain right now?
No.
Okay, and can you tell me where you are right now?
Good Samaritan.
Okay, and what are you doing here today?
Came in for a head-to-toe analysis.
Okay, and can you tell me the date and year?
March 25th, 2020.
Okay, and my patient already told me his name, so he is alert and oriented ×4. He's in no pain. There's no IVs or tubes that he's connected to, and I don't see any kind of labored breathing. I just want to check and see, do you need anything before we get started, or do you need to use the bathroom? You're all set?
Yes.
Okay. Well, I'm going to go ahead and start at the very top. Is it okay if I remove your hat just for a moment?
You put it back on.
I'll put it back on. Okay.
Thank you.
So I'm just going to set this right here. So I'm first taking a look at his hair. It's evenly distributed. It's a little messy just because of it being in the hat, but overall hygiene is good. There's nothing living in there, and there's no signs of alopecia. I'm gonna come down. Ooh, sorry, I almost forgot. I'm gonna put your hat back on.
Thank you.
But I still need to come right here because I'm gonna feel for your temporal pulses,
Okay.
which are 2+ and present, which is normal or expected. For my assessment, I would want to do my vital signs. I would start with temperature, and for a normal adult, the expected finding is 98.6 to 100.4. And for an older adult over 65 is 98.6 to 98.3. Normal respirations is 12 to 20 breaths per minute. Pulse is 60 to 100 beats per minute. And the pulse ox is 95 to 100%. And then lastly, the blood pressure is anything less than 120/80. Okay, so I'm just going to need you to bear with me. I have my little pen light here, and I'm going to shine the light in both of your eyes twice, okay?
Okay.
Well, first let me just open your eyes, and I'm going to measure your pupils, which are about a 4.
Okay.
So can you just look at that picture over there for me?
Yeah.
Okay. So I am looking first at this eye. I'm looking for a direct response, so I'm looking directly at this eye. So, and when I did that, it constricted to about to 2 millimeters. So I'm going to do the same eye, but this time I'm going to be looking at this one for an indirect response. Okay, and the other eye constricted as well, and the same thing. Constriction, and now I'm looking at this eye. Okay, perfect. And now the last thing I need you to do is look at the end of my pen, and I'm gonna just follow the pen, okay?
Mm-hmm.
Okay, and there was conversion there, so it dilated as my pen got further away and constricted as I got closer. And in the other eye, it also went to 2 millimeters. Your pupils are equal, round, and reactive to light and accommodation. Now I'm going to be looking at your mucous membrane, so I just need you to open your mouth for me, lift up your tongue. Okay, and I'm going to be looking in your nose. The membranes are pink and moist, which is what we would like to see. There was no cuts or sores or any cavities that I could see. Okay, moving down the body, the next thing I'm going to do is I'm going to be feeling the carotid pulse, but not bilaterally this time, one at a time. And both of those are at a 2+ with a regular rhythm. I'm gonna be coming down and I'm gonna be feeling for your brachial pulses bilaterally, which are at a 2+. And then at the radial pulse, which is also a 2+. I am feeling the warmth at the arms and looking at the skin, which is true to your ethnicity, and it's warm to touch. I am going to be feeling for edema at both of your wrists. And then I'm going to be feeling your skin turgor, which chest hydration, which your skin snaps back to its normal place very briskly. I'm going to be doing your capillary refill, and it returns back to pink in less than 3 seconds, so I would describe that as brisk. Activity now, so if you just close your eyes for me and just let me know where you feel this. Upper arm, lower arm, right and left.
Right upper arm. Lower left arm. Higher left arm.
Okay, good. And also, while I was checking the capillary refill, I was assessing the nails, which are rounded at the tip and are clean. The next thing that I'm going to be doing is a chest assessment. Is it okay if I lift up your gown?
Yes.
Okay. So I'm going to lift this up. And I'm first just going to be inspecting for symmetry. What I see on the right side is what I see on the left side. His body is a 2-to-1 ratio, which means he's twice as long this way as he is this way. I don't see any use of accessory muscles or any labored breathing. You're not in any kind of pain, are you?
No.
And you're okay laying back that way?
Yes.
Okay, so now I'm going to be listening to some of your lung sounds.
Okay.
Okay, I am going to start at your trachea.
Okay.
And this is a bronchial breath sound. Okay, and I only need to listen to one of the sides for this one because it is the same on both sides. The next place I'm going to be listening for is at the top of the lungs, which is called the apices, and this is a vesicular breath sound. Take a deep breath for me. Okay. And the other side of the apices. Deep breath for me. Okay, and the next thing I'm going to be doing is I'm going to find your ankle of Louis, which will bring me to the second rib, and I'm going to come to the second intercostal space, and this is the bronchiovesicular breath sound. Deep breath for me. And I'm going to be listening to both sides. And a landmark to help me find where this spot is this is the midclavicular line and in the second intercostal space. And then the next place I'm going to go is to the fourth intercostal space. This is also a bronchiovesicular breath sound. Deep breath. Deep breath. And now I'm going to be going to the sixth intercostal space. This is a vesicular breath sound. Deep breath for me. And let me come back here. 6 again. Deep breath. And then I also have to do intercostal space 8, but I will be doing that towards the end when I have him sitting up on the back. It's much easier that way. The apices once again on the back, which is at the top, and this is a vesicular breath sound. Take a deep breath. Another deep breath. And then can you just crouch down for me like you're an angry cat? No, like put your head down. Like, yeah, good. Okay, so at this bump right here, this is C7, and I'm gonna come down to T1, 2, and T3. And I'm gonna listen here, and a landmark to help me on the back is the mid-sclavicular line. Yeah. I'm gonna be listening to T3, which is a bronchiovesicular sound. Deep breath. And deep breath. And here is T4, which is a bronchiovesicular sound. Deep breath. T4 again. Deep breath. I'm going to come to T6. This is a vesicular breath sound. Deep breath. Deep breath. I come down to T8, vesicular breath sound. Deep breath. And deep breath again. And T10. Take a deep breath. This is also a vesicular breath sound. Deep breath. And this patient is 6'3", so in taller patients, sometimes there is a T12, and I've never had a patient that way, but I would assume it's down here, and I can still feel, so I'm just gonna go ahead and listen to T12 in him, which is also a vesicular breath sound. Deep breath. And a deep breath. Okay, and then I'm also gonna do 8 on the side, and this is a vesicular breath sound. Deep breath. And one more time. Okay. And just so you know what each sound name means, the bronchiovesicular, the inspirations and the expirations are equal and the same. The bronchial breath sounds, the inspirations are short and the expirations are long. And the vesicular breath sounds, the inspirations are long and the expirations are short. When listening to the lungs, they were clear to auscultation. There was no adventitious breath sounds, no crackling or wheezing. Everything was a normal finding. Okay, while I have him with his back visible, I am looking for any kind of skin breakdown, which I don't see. And also I'm going to be feeling for his spine all the way down, which has a normal curvature. There's no lordosis, kyphosis, or scoliosis. The next thing that I'm going to be doing is an abdominal assessment, and once again I'm going to need to lift up your gown. Is that okay?
Yeah.
Okay. Just lift it up to right here. The first thing that I'm going to be doing is just inspection. He does have a few stretch marks, which is also called striae. The umbilicus has a couple hair around it, but it is clean. Your abdomen is rising and falling symmetrically, and there's not any kind of pulsations or distensions. The next thing I'm going to be doing is auscultating, which is listening, and I'm going to be starting in the lower right quadrant, and I'm going to be using the diaphragm of my stethoscope. Okay, bell sounds are active in all 4 quadrants. The next thing I'm going to want to listen, or not listen for, is what we call bruits. And for that, I'm going to need to switch my stethoscope over to the bell. And now I don't want to hear anything. I'm going to be listening at the aorta. The renal. the iliac, and then I would also want to listen to the femoral. Continuing on with the assessment, I would want to feel his femoral pulses, which I'm sure are 2+ with a regular rhythm. I'm going to be feeling for his popliteal pulses. His feel a little deep. I'm going to say this is a 1+, but they are present. I also would want to assess the posterior tibial pulse bilaterally, which are at a 2+, and the dorsal pedis pulse, which is also at a 2+. I am going to be feeling for edema at the ankles, and once again temperature and the color, which is true to his ethnicity and warm to touch. And just like on the wrists, I'm going to be feeling for edema here, which is swelling. And there is no edema on the ankles or the wrists. I'm going to be doing the capillary refill on his toes, which is brisk, less than 3 seconds. And the nails down here are clean and trimmed. I'm going to have you close your eyes. The same thing. Upper left, upper right, upper, you know the drill.
I know.
Okay. Okay.
Right upper leg, left lower leg, left upper leg.
Okay. And then, could you please push on my feet like a gas pedal? Good. And pull up. Okay, I'm just checking the strength in his feet, which is a 5, and the muscle tone is there. He could do it on his own. Okay, we're getting towards the end. Can you please swing your legs over the bed and just sit there? I'm gonna just check a couple more things. I already checked your strength in your feet, so now I'm gonna do your legs. Could you just push on them for me? Okay, and pull back. Okay. Of a 5, I'm going to do the same thing with your arms. Can you push up? Okay, and can you push down? Okay, and then with your face, can you push into my hand? Good, and can you push into my hand again? And his strength is all out of 5. And I forgot to mention this before, but I want to describe his muscles. They are tone. There's no muscle atrophy, which would be mass, and then there's tone, and all of his strength is at a 5. How long would you say that it takes you to get ready in the morning?
20 minutes.
Okay, and do you find yourself needing to take any breaks or sit down?
No.
Okay, so you have good endurance, you'd say?
Yeah.
Okay. The next thing I'm going to be doing is looking at all of your ranges of joint motion. The easiest way to do this is just to mirror exactly what I do.
Okay.
I'm going to help you down, okay?
Thank you.
Okay. We're going to be starting with our neck. So you're going to touch your chin to your chest, flexion, and return to your normal position, extension, hyperextension, which is all the way back. Okay, return to the normal position, and then we're going to do lateral rotation, which is turning your head on each side. Ooh. And then rotation, which is putting your head in a circle. The next thing that we're going to be doing is our shoulders. We're going to start by flexing, so we're going to pull your arms all the way up, and return, which is extension. We're going to hyperextend. We are going to abduct and adduct, and then we are going to circumduct. And then we have lateral rotation, external rotation, and internal rotation. Or no, internal and external. Okay, is your shoulders, which is simple. You can just flex and extend. Okay, we're now going to be doing our forearms, which is pronation and supination. And we're going to do our wrists, which is flexion, extension, and hyperextension as far as you can go back. And then adduction and abduction. With our fingers, we can abduct, flex, extend, hyperextend. And then with our thumbs, you can abduct and adduct. And you can flex and extend, and opposition, which is touching each finger to the thumb. The next thing that we're going to be doing is our hip. We'll start with abducting and adducting on both sides. And we are going to flex and then extend, flex and extend, hyperextend and hyperextend. Good. We're going to do internal rotation, external rotation, external rotation, and circumduction. The next thing that we will do is our knee, which you can flex and extend. Flex and extend. Okay. And then for our ankle, we are going to do a plantar flexion and dorsal flexion. Plantar flexion and dorsal flexion. We are going to do inversion and eversion. Inversion and eversion. And lastly are your toes. So just flex them as far as apart as you can.
Wasn't ready.
Flex, which would curl them up and put them back out, and abduct far apart, put them back together. Okay, the next thing I want to do is assess my patient's gait, which is the way they walk. So I'm going to have my patient walk towards me. Go ahead. Walk as you would normally do. Okay. His head is erect, over shoulders, and his shoulders are over his hips, and his hips are over his feet. He had good balance and good posture. This concludes my assessment. Do you have any questions or concerns, or is there anything I can get you right now?
No.
Okay, well, here is your call light. I'm just one call away, so just let me know if you need anything. I'm gonna close your door. Thank you.
You're welcome.